Hi guys, Dr. Christy Ennis. Recently I have had a lot of questions about inguinal hernias, maybe because of all the shoveling that's going on out there, although not in New Hampshire in winter, go figure, weird weather. So today we are going to talk about mostly exercise, because that's what we do here, and we're going to talk about the don'ts and the do's. But before getting into that, you might want to know what causes it and what some symptoms can be so that you can hopefully avoid that too. So it's much more common in men than in women, 27% of men actually and 3% of women. And part of that reason is because of the inguinal canal in men. That actually leads to a weakening of that abdominal wall just as it is. And so with that inguinal hernia, part of the intestines comes out of that lower part of the abdominal wall. Sounds scary, but it's not the end of the world, hopefully. So with that being said, women can also get this happen. That's good English. And women can also have this happen a lot of times due to pregnancy, because an increase in intra-abdominal pressure tends to lead to this hernia no matter what, even with strong abs, believe it or not. So pregnancy certainly increases that. Constipation is another one, because you're kind of straining. You're doing that Valsalva mover where you hold your breath and bear down. That's going to put lots of pressure in there. So I'm actually linking a video that I did on constipation just in case that happens to be you as well. You can take a look at that. Now, some other things that tend to cause that can be straining, not just with constipation, but a lot of times I see that in heavy weightlifting. And I certainly have patients come in here that are in great shape and still have that hernia happen, right? Coughing and sneezing are other big ones, again, because those increase the pressure. Now, symptom-wise, you may feel nothing, except for maybe a little bulge right down there, right? That's kind of a telltale sign right there. Now, if you feel nothing, yay, let's hope it stays that way. There are going to be probably some more exercise things that you guys can do than if you're really having a lot of symptoms, meaning nausea, vomiting, pain, and we can be talking about intense pain down here, so really keep that in mind. The other thing that's really important to keep in mind is that even if a hernia isn't bothering you right now, it can get worse, and it can get a lot worse and actually be a very serious problem that will need immediate attention. So really keep that in mind. Now, if it does not need immediate medical attention, you do still want to check with your doctor to make sure it is okay for you to do any exercise, even the ones that I have on my do list. Everybody is different, and like I said, that hernia can get worse, and you absolutely do not want that to happen to you, and I don't want that to happen to you. So with that being said, let's get started with those don'ts. Starting off with our don'ts, we want to avoid any exercises that really increase that intra-abdominal pressure. Now, typically that is going to be a lot of things with heavy weights. So remember, you really want to avoid anything with heavy weights right now. But some specific exercises that can be a little bit more of a problem than others are things like squats and deadlifts and lunges, good mornings, leg press, especially like I said with heavy weight. So those you probably want to put, not that you have to get rid of them forever, but you do want to probably put those on the back burner for a wee bit of time, especially if you're getting surgery. You want to wait till after that. Now, anything that actually stresses the abdominal wall is also what you want to avoid, as well as stretching the abdominal wall. So that any ab exercises that you probably traditionally think of, like crunches and planks and leg lifts and twists. We're not going to twist the night away right now at all, okay? So unfortunately, yes, those are out because you can absolutely make those symptoms worse. Now, stretching the abdominal wall, a lot of people don't think of, but that would include things like the cobra pose in yoga. I'm going to get down on the ground in case you guys don't know yoga stuff. So, right, anything like this or upward dog, you can see how that's stretching out those abs nicely, which feels great if you've just worked them hard, not great if you have a hernia, okay? So get those out of your repertoire for now. Now, push-ups also can be an issue. Again, you're stressing that area. We do find that sitting and standing tend to be a bit more comfortable and a less stress on that area than lying down exercises are as well. But make sure if there's anything in this list that you're questioning, you ask your doctor as well. And let me stop going wah, wah, wah about all the things you can't do, and let's start talking about things you can do. Moving moving on to the things you can do. Yay, focus on the positive now. That's always a good thing. Now remember I said no heavy weightlifting, but very oftentimes if you do not have symptoms, you can do light weightlifting. I tend to start my patients out back just with basic body weight kind of stuff. Sometimes some light dumbbells, seated bicep curls tend to be okay too. You're not usually causing a lot of stress there. Again, check with your doctor to make sure on that. So there's a whole lot of stuff you can do just with lighter weights, and you just increase your reps a little bit to get some more work. No holding your breath and no straining. Those are key points to remember. Now, I talked about some yoga don'ts. There's a great yoga do that you can do. Do that thing that you do. The chair pose. So kind of like a squat, right? You're gonna bring those arms up. My lats are limiting, just so you guys know. And then you can come down into that partial squat, right? You can bring those arms closer together. Do not add the twist component of this. So we're just working on strengthening things. You can hold this as long as, again, you are breathing. Breathing is an absolute must, okay? And that's the next thing we are actually going to talk about. I'm gonna get down onto the ground. You can easily do these just right in bed too. I know I said we don't wanna do a lot of exercise on the ground. A little bit is okay, especially when we're talking about things like these next ones. So when we're talking about abdominal breathing, what we really want to focus on is filling up that belly when we breathe in and then letting it go when we breathe out. So it is just a simple breathe in and breathe out. Trying not to let the rib cage move up, right? We're really focusing down in here. And this is actually part of your core. So it's super important to make sure that these breathing techniques are working so that you can get all those core muscles working properly too. So great one to do, and it calms down the nervous system. What could possibly be better? All right, from there, still focusing kind of in that deep region, you're gonna add some pelvic floor work. Now, I'm gonna do it and you're not gonna see me doing a thing unless my eyebrows move, right? So it's really thinking about pulling up and in on those muscles inside the pelvis. If you're a female, I usually tell people it's like pulling a marble up and inside. Please don't try that actually at home. Men, it's raising that penis. So if you're doing it correctly, like I said, you really shouldn't see anything, and you'll feel that kind of right deep down into that abdomen. You know when you're doing it wrong if you feel your butt, right, lift off and squeeze. If you squeeze your legs together, that was an example of me holding my breath. Don't do that either. Remember, no holding breath at all. Now you will feel it towards your butt because those muscles are a sling and attach from front all the way to back, but you don't want to actually squeeze the butt. And I'll link a video on pelvic floor strength here too, so you can get a better idea of that. Sticking along that same line, you're going to think about what we'll just call a little belly button pull. So it's not a brace, right? We don't want to do that right now. It's literally just taking your little, I got an innie belly button, and pulling that towards the spine gently. Okay, this is getting kind of those canister muscles to do their job. So again, it's not tilting the pelvis, it's not sucking in, it's just a little tiny belly button pull in. I call it like not Thanksgiving Day tight pants that you have to put back on, but maybe you just ate a little extra and you're just, trying to get that zipper closed a little bit. Now, once that feels okay and you've got that nailed down, I usually have people take their hands on their hips, engage in through there. You can even add those pelvic floor muscles if you want to at the same time, woo, but no holding your breath. And then you're gonna alternate, just bringing one leg out to the side and then the other without those hands on your hips moving and without pushing your abdominals out. That's your base of stability right there, okay? Next one on the ground, and again, please do ask your doctor about this one, as sometimes this one can be too much, but a little bridge. So if I'm thinking about just kind of gently lifting that butt up, I'm engaging in through those glutes, do not push the abs out, and then coming back down, right? You can do a little pelvic tilt to engage those glutes even more. And for all of these, you can shoot for 10 or 15 repetitions. And then one more that I like, I'm gonna scooch around this way, is the clamshell. So still working on some of those butt muscles, the side butt muscles this time. We're in a nice straight line, so if I look down at my feet, that's all I see, not much of my leg. You're gonna bend those knees, and then you're gonna lift that top knee up. Now, again, being careful, of course, to make sure that you're not holding your breath and that you're not straining in through that abdominal region. And I usually have my patients shoot for about 20 reps of this one. So there you have it, don'ts and do's. And if you like what you saw today and want to see more, please check out my locals channel or my membership page, where I am really trying to gain some support so that I can film even more videos for you guys and you can be a part of that. Thank you.